Indigenous peoples throughout the world have long histories of food systems dependent on traditional knowledge of their local ecosystems. The extensive biodiversity Indigenous peoples' food, plants, and animals merges healthy diets with local culture and practice. Today, Indigenous peoples often face extreme poverty in the modern industrialized world, and they are among the most vulnerable and marginalized people. Food in their local and rural ecosystems and the cultures themselves are threatened with extinction. Environmental, economic, and social transitions all contribute to these threats.
It doesn't have to be like this. Indigenous peoples' food systems have many benefits. Healthy food, physical activity, sharing, community culture, and cultural identity. But there are also threats that must be addressed. Ecosystem decline, climate change, commercial overharvesting, poverty, moving to cities, dams and mining, and encroachment of outsiders. Indigenous peoples must take control of their food systems and protect them.
This film is an introduction to a project created by the Centre for Indigenous Peoples Nutrition and Environment called CINE at McGill University in Canada. This project shows how sustaining local food system knowledge will improve well-being and health in Indigenous communities and protect culture at the same time. CINE is a collaboration of Indigenous community leaders, university researchers, and local governments. Together, they are exploring ways to maintain the health of these transitioning populations and preserving knowledge of their local food systems before they are lost forever. Chief Bill Erasmus and Dr. Harriet Kuhnlein led the start of CINE and developed this project with many international partners. CINE evolved because Indigenous leaders in Canada wanted to have a place where the real issues of Indigenous peoples' food systems could be researched and discussed. The governing board, established by Indigenous leaders, guided understanding of how to work with people in a meaningful way, with good participatory process, to answer the questions that were important to them, to do the research that had resonance and meaning with the community members, and to address concerns about integrity of traditional food systems.
Well, CINE started because there was really no facility for Indigenous peoples in the north to go to where they could get their own samples done, for example, on quality of fish, or to do our own samples on caribou, for example, or on soil testing, water testing. We quickly found that the whole question of Indigenous foods and Indigenous environments and the way people interact with the land is something really that has no boundaries. And we began to get requests from people in the southern parts of Canada, the provinces, in the States, because of a whole number of concerns and a whole number of issues. So we began to expand. As we began to get more established, more and more people began to come to us, asking us if we would work with them to do studies, to help them look at their particular problems. And that's how this global initiative began.
CINE is now working with 12 communities worldwide in a global health project. While each case study has its own unique methods and findings, the use of Indigenous foods in the culture is related to overall health. Each area has a community leader partner and an academic partner based in the country.
Well, from a nutritional point of view, we have consistently seen across all of our case studies, wherever we look, that when people incorporate more of their Indigenous foods into their diet, the overall picture of the diet is much better. We have case studies where up to 80 to 90% of their daily energy is coming from their local food system. When they start buying the low-cost foods that are in their stores with the small amounts of money that they have, what they're buying is inexpensive, cheap, poor quality food. It raises the calories, it raises the sugar, it raises the bad fats in the diet. And people wouldn't be having all of these bad things if their diet was entirely composed of their local food system.
One of the consequences for many indigenous groups with a shift away from subsistence traditional foods to market foods that are purchased for cash. They may be imported from another part of the country or from other countries. One of the consequences is often an increase in total fat intake, total energy intake beyond requirements. And if that occurs at the same time that the activities of daily living are changing so that energy needs are less, then we get an imbalance and obesity begins to emerge. Why do we care is that obesity predictably drives the appearance of certain other diseases in the population. High blood pressure being one, diabetes being another, premature heart disease, and there's a long list of less prevalent ones. But these are important because they shorten lifespan and they produce huge impacts on quality of life. Diabetes is important for several reasons. Unmanaged or untreated or poorly treated, it will produce complications which are truly important for quality of life as well as expensive medically. Things like blindness, serious complications, amputation of limbs secondary to circulatory problems, etc.
Diabetes and heart disease resulting from poor diets are common problems in Indigenous communities, combined with extreme poverty, food insecurity, contaminated food sources, and land rights issues. CINE's approach when partnering with communities is to follow a very carefully developed methodology.
The first thing that people have to do is understand what they've got and what they have to lose if they are no longer practicing their traditional food system harvesting and use. The first step is for people to just take a cold, hard look at their resources, to document them, to put it in writing or put it into oral culture so that the next generations have the benefit of this knowledge. From there, people can work together and understand how they can create a momentum for using more of these foods and protecting these foods in their local environments. Okay, so that's one of the things that we have been emphasizing in these cultures that we're working with.
We help one hunter to go out on the land. That hunter doesn't only get food for himself, he gets food for his extended family and for needy people in the village. So that one person is assisting a whole lot of people. And that's what we mean about the cultural aspect of it, the sharing and the assistance to others. There's so much to it. You help that one person out, the spin-offs go to 30, 40 other people.
There are examples of excellent nutrition in Indigenous peoples' traditional food. For example, the Inuit have a favorite traditional food of the whale muktuk, which is composed of the skin and underlying fat. You wouldn't think there would be vitamin C and minerals in this, but there is. It is just like eating fruits and vegetables. High amounts of vitamin C in the skin, high amounts of vitamin D, and the good fatty acids in the blubber. There's the vitamin A, the zinc, and the iron. It's all there. It is hard to get such a concentrated source of good nutrition from the store. Another example comes from the project in the Ibu territory documented by researchers at the University of Nigeria in Nsukka. They did a careful analysis of diets from all segments of the population, including women, children, and men. They consistently found that when people ate more store-bought food, it increased the sugar, calories, and fat. Then they did not have the same amount of good nutrition. Nearly all the good nutrition from vitamins and minerals were coming from the traditional palm fruit oil, fruits, vegetables, root foods, and small amounts of animal foods grown in the communities with traditional agricultural methods. CINE's case studies include research on environmental impacts on local food systems.
There are so many links between Indigenous peoples' food systems and the environments in which they're based. And many of these links are very complex. And they relate to everything from water quality to seasonality to productivity of different resources. And so something like climate change, for example, has impacts in all kinds of different ways that we often don't anticipate, but that people who are very close to those resources would understand better.
Since 2004, Global Health Project participants have met annually to present findings, compare strategies, and share successes in a collaborative atmosphere.
What we're finding is that there's a huge wealth of information with Indigenous cultures. People have a whole system of raising their children, their connection of the food and the land. It's cultural, it's spiritual, it's a whole encompassing aspect of them, and if they're not connected to that, if they're not a part of that, then sadly there's a lot that's missing. Because, for example, if people hunt caribou, then it's something that they've been doing for thousands and thousands of years. There's rituals involved. There's a certain way to harvest the animal. There's a certain way to skin the animal. There's a certain way to preserve the food. There's a certain way to share the food and to enjoy it. And all of that, I think, is part of what makes people feel who they are. In our case, make them feel Dene. And if you don't have that, then you're having people that are existing at a very different level. And I think the contribution of those foods and the culture and people feeling good about themselves is very, very important in this day and age. Big part of it is handing down the teachings, the culture. It's part of the language also, very connected to the land. Passing that on so that people are confident and feel good about themselves.
Professional staff based at CINE have worked with many cultures worldwide over the last several decades. This has created a tremendous knowledge base about the benefits and threats to Indigenous peoples' food systems.
Actually, CINE helped us in documenting traditional food systems and taking some interventions in the project, in systematic documentation, providing scientific evidence and all. The strengths of the CINE are, it never talks about nutrition. It talks about people, their rich culture, their environmental concerns, their cultural concerns, their lifestyles, and they talk about nutrition and health. So many organizations which work on nutrition directly spoke about nutrition and failed. But the greatest strength of the CINE is they start with the people, with the communities, and they talk about their concerns like health, nutrition, food systems, and all.
That's why something like this project is so important, because you have input from people from many different parts of the globe, all putting their knowledge together essentially, and then they really start to see the different impacts emerging that are common to everyone. And obviously there are not enough resources or time to work with every Indigenous community in the world. So the idea of taking representative groups or communities from different places and using similar methods to assess and evaluate the traditional food systems and the changes that have occurred to them, then you get a much stronger and more robust picture of what's happening all around the world, and then you can take those results and work with them and figure out, how these problems can be solved on a global scale.
It gives us a much greater, a much broader vision, and it makes you realize that you're part of something bigger, and that working together and being part of something bigger, that it's more than a summative effect. it's a synergistic effect, and that actually, maybe working together like this, we can have an effect, and not just takes you out of your own small environment, which is very important, but it's something so much bigger. Well, it mustn't stop here. We started the ball rolling, and so many nutrition improvements and interventions, you need to be constantly motivating change and reminding ourselves of the need to improve and finding new ways and ways of maintaining what has been started and ways of stimulating and scaling up what has been started. There are a lot of people out there that can benefit from our process, and we need to share it and help to maintain that for it to continue.
The Global Indigenous Voice is calling. Attention to the benefits of traditional food systems and the risks of losing them. CINE will continue the work to promote these resources for Indigenous peoples everywhere.
We need to be able to control our own resources.
Salmon's always been part of our life. It's the very essence of our existence.
No canche necesitanche alpan, porque pues carne es sagrado, no canche manda.
Inaput sila tunang meg tigu mel tigi gatigu, kitonga tinu tuna utigi vatabu sivu nisanginu.
Kawati pa mumude li u long yua.
Now our communities are hunger-free and also healthy.
The world is losing Indigenous peoples' culture, environment, and health. It doesn't have to be that way. Visit CINE's website to learn more.
Masi.
ధన్యవాదాలు.
Pai mamita.
Say question. Kuyanami.